first thing I'll say is that this is the second time I've joined the Asia 21 event. This one a lot longer than the previous one, where I just spoke and left in San Francisco in, I don't know, 2018, I think it was. But the difference is at that time I was still the CEO of Medtronic, and I was very busy. And now I've retired, so I've got a lot more time, so I could spend the whole day here and a lot of yesterday, and I'll spend a dinner with you, and I'm looking forward to engaging with all of you and your successors in the future in any way that I can, and help and give you advice or in whatever way I can help. Now, talking about healthcare and AI in healthcare, I had a few slides. I wanted to go through those to give you an overall perspective of my thoughts on this. And then really the bulk of the time I'd really like to have a discussion and answer your questions, or I don't know if I can answer them all, but at least sort of attempt to answer all your questions. Let me start then by talking about some key principles in healthcare that I've sort of developed in my head over time, and one that I keep learning about. And the first principle is written here. Just read it. Our desire for longer, better lives will never go away. So, if someone tells you that you're not going to live, or the human race's lifespan is limited to 100 years or something, I assure you that's wrong. 100 years from now, I'm sure it'll be well over 100, the human lifespan. And so our desire to get longer and better lives will continue. And the second point is that there is no end to advances in technology. Where technology has evolved in the last years that you remember, what it is today versus what it was 10 years ago, 20 years ago, that's not going to change. The same difference that you see today, with a cell phone and before it was like landlines or whatever, or laptops to mainframe computers, those changes, if anything, will only accelerate that type of change. And AI actually is a piece of that, which I'll come to. So these two fundamental principles I've always maintained. And so in business, for example, I always thought of a technology company in healthcare has to be a growth company, or you're doing the wrong thing, because of these two facts. The second big point that I'd like to make, which also over time, a reasoning that I've developed, and this is another way of talking about something that in the healthcare world is known as value-based healthcare, but people kind of tweak that in many ways simply to think that that's cost reduction. It's way more than that, in fact. If you improve outcomes, and just in the previous slide I mentioned that our desire for improved lives will go on forever. Well, if you improve outcomes, which you actually do, and if you provide access to those outcomes, that means more people around the world can get them, you'll actually lower the cost of healthcare, not increase the health of healthcare. Because if you can catch diseases early and treat them before they escalate, it's actually lower cost. And often people don't see that, and they think of, if I want to improve healthcare, where do I get money from? And while I understand that, at the same time, if you really focus on the outcome first, you'll generate your own money. Because people will not access the hospital to the degree that they do today if you look after them before they get to the hospital. And if you improve the type of care across the world, then you'll get more volume and your cost will go down. I remember one piece of learning that I had when I started work at Medtronic, which was very focused as a company on improving outcomes. That's the whole mission of the company, using technology. And the fact that a pacemaker, which is the device that Medtronic was founded on in the late 1950s, that pacemaker in the U.S. and the Western world, anyone who needs it kind of gets it. I mean, Medicaid and all those, whatever. I mean, this is so common that if you need it, you get it. And I asked a question to the team as I was thinking of globalization and providing healthcare to people around the world. And I took India as an example, that in India, people who could afford to pay for the pacemaker from their own pocket, that means they have enough money to buy houses, whatever, and if they fell ill, they could pay for it, and they'd live another 20 years or longer because they had the pacemaker. It turned out that in that segment of the population who could afford to pay for it to extend their lives, less than 20% of that population actually got the pacemaker. And why is that? That's because if I took a box of pacemakers and I put it in a village in India, what do you think they'd do with it? In a village hospital in India, they'd use it for something else, they wouldn't even know what it is. Because there's no referral chain, there's no trained doctors to do that, they don't understand the mechanism. So, to do this requires a whole infrastructure that needs to be worked on. So much about healthcare, and I can go on, as you can see, for a long time talking about healthcare, but let me jump into AI for a minute. And, this is not really my expertise. Technology in general is something I'm interested in certain areas I know more than others, but I tried to kind of really look at AI from a macro level. And AI, really think of it as these three things. You have predictive AI, which actually has been around for a long time. It's been around, 20 years, and it's getting better and better, but predictive AI has been around for a while. And that uses machine learning and deep learning. So you create models through which you can predict the future, and that's what predictive AI is. Generative AI is the one that's got all the noise around it, and it's more recent. And ChatGPT is the big symbolic thing of that, which suddenly caught everyone's attention, and it's a big deal. Where that information that's generated by predictive AI is actually translated into generation of messaging or methods of communication, which is automated, and that can be text, which ChatGPT is. But it can also be images, which is growing. It's not all the way there yet. It could be videos, it could be sound, and it could be coding. So you could generate automatic coding means software coding, because of generative AI. But it's still open loop. That means you take the information and you generate information. You take the data and you generate information. And then you depend on the person using the information to do what they want to do with it. The third stage, which is still, I think, in a fairly early stage, we call it emerging, is agentic AI. And that's when you take this information that generative AI has created from the predictive AI models, and you actually close the loop with it. So you go and you change something else because of the information that you just generated with the AI. So you can create entire systems that are then automated, and entire mechanisms of operation that are then automated, which then takes this to a new level. In many ways in healthcare, some of that, we haven't called it that, but we've applied it in very simplistic terms. Medtronic, for example, is a device company, like I said, like a pacemaker. You can take signals. Medtronic does a device which they recently launched, which does pain management, a device, not a drug, where you stimulate the nerve to reduce pain. But if you move around, for example, the location, the targeting may change. And so there's a methodology that was developed where data was collected as to how effectively it was targeting, and changing the strength of the signal, doing the stimulation based on the movement of a person. Now that's not quite all of AI, but as this thing develops, AI models will be used to detect those signals and to go and manage that pain. So this is a closed loop system in a very targeted fashion in one person. This can be done in many other examples in a bigger way, but that's what I mean by agentic AI, and that's what's being developed right now. Let me finish here with a couple of slides. First, if I now join together what I just said, and I apply it across the care continuum in healthcare, what do we get? And the care continuum in healthcare is the following. You start with people who are well, and preventing people from getting ill is the first stage of healthcare. Second is, well, it's a little late, you've already got a chronic disease. You've got heart failure or whatever, anything. Diabetes, chronic disease means a disease that doesn't go away. And you have to be checked. And for that, you need to be monitored. But usually you just go to PCP is a primary care physician. You'll go there and you'll get checked every so often because you're in an early stage. Then, if that doesn't get taken care of, it becomes acutely chronic. Now you need a monitor to make sure something doesn't suddenly happen and you get an incident and you can pass away, or some other more serious thing can happen. And for that, you need at-home monitoring. You need much more frequent visits to the doctor. The disease has just got worse. If you still don't do anything about it, or whatever reason the healthcare system hasn't been able to deal with it, you go into an acute episode where you need to do a procedure in a hospital. And then when you discharge from the hospital, then you get post-acute monitoring, now in a far worse condition. So this is, if you like, what I call the care continuum in healthcare. And you really want to sort of deal with this at the earliest stage possible. Because if you can deal with it at the earliest stage possible, you'll prevent the people from getting ill. And actually you'll lower costs and you'll improve people's lives. But, you know, technology has really affected this a lot, even across this whole chain. And actually, more money and effort has been put onto the right of this, to the acute episode, for a variety of reasons. Because hospitals, you know, there's financial reasons and so on. But I'd really like it to move a little more to the left to prevent more escalation rather than just treat. But from the way of treatment, you know, one thing that really caught my attention, a doctor once told me when I was visiting a hospital in the US, that the people in the ICU, you know the ICU is the critical care unit in the hospital. The people in an ICU in a big name hospital in the US, if you walk in today and you see them, in those conditions, none of those people would have been alive 10 years ago. So the conditions that they have 10 years ago, they would have never made it to the ICU. So this is all know-how, back to my very first slide, our know-how of the human body, our application of technology will continue to improve healthcare. My hope and my desire is that that effort certainly should stay on the right end of this, but I'd like to move it more to the left. And if you can move it more to the left, then you can prevent illnesses to start with or manage them at an earlier stage, and not to take away anything from the right, but on the left you can improve people's lives further. Let me finish with with nearly 4 points about usage of AI now applied to healthcare. The first thing that you'll get as you apply AI is you'll get faster and more accurate diagnosis and patient management. And a lot of this actually has existed. Automatic looking at tumors and so on has existed. You know, recently there was a study in the US which showed that the detection of a tumor through AI, the accuracy was over 90%, through a physician was 60%. Even if the physician used AI tools, it was less than automated AI usage for that patient. So, you know, this is fairly well established. It's the first thing that I said, where you're looking at data and you're just looking at patterns in the data, and AI is like perfect for that. And so that's the diagnosis and really patient management from that. But the second thing, which I'm also very, very keen on, that I think will change healthcare in the next 10 to 15 years, I hope, is that today, you know, management is done by looking at cohorts of patients. I mean, patients with a certain disease state get treated in a certain way, and you try to narrow that because people's diseases, you know, if you're older, it's a little different from if you're younger, and so on and so forth. But I think with AI and with the availability of data, something else is going to happen. An individual's data actually can dominate, and if you get accurate treatment available to the individual's data over time, if it's available, will focus the treatment and focus the diagnosis on an individual. And I think over the next 10 to 15 years, as AI takes off more, as more data is available for a patient's condition, the treatment is going to become what I call an N equals 1, as opposed to a massive number of patients. On one patient, time gives more data. More data develops better AI. Better AI applied to that patient is more customized to treating that patient, as opposed to a group of patients. We are averaging the treatment, as opposed to specifying the treatment. And so that is something that I do think will happen. The last 2 points are a little more sort of efficiency driven, but important. I think drug discovery process, which is, you know, I call it statistical in the biotech world, because you know, they do experiments, biological experiments, and then they develop drugs, and the hit rate on that is not high. And I think through AI methods, which I think actually NVIDIA is pushing very hard, you know, you can probably improve that quite a bit. So that'll create more drugs more quickly, and can address tighter cohorts of patients. And so broadening it, because the drug companies want to get their money back, and believe it or not, they try to sell to as many people as they can, and there's no feedback loop which says that this guy really doesn't need it. So if you can make the drugs cheaper and quicker, you can sort of focus it on tighter cohorts, and you'll get less side effects and things like that, and the drug companies will still make their money, because, you know, otherwise they don't get the volume. So this way they'll get the volume and the focus. And then finally, you'll get operational efficiency, which you'll get in other areas too, across hospital systems. If you've been to hospitals, you know, my experience is most in the US, but you go anywhere in the world, you know, I mean, you're going to fill out a form 15 times, and you're going to repeat things over and over again. You know, things like that will get automated. Doctors make mistakes. They have to write reports, sometimes they make errors. All that stuff can be automated. That can be done right now. And a lot of work is being done there. I do have one more closing slide, which I really want to finish with, and then we'll start the dialogue. I really think of healthcare as, of AI in healthcare, can it take us to where the cell phone took us from the landline? The one thing, and this is a global example, villages in the world, and even in sort of developing countries, even in cities, 30 years ago before the cell phone, or 20 years ago before the cell phone came along, to get a phone line took a year's worth of application if you even got one. Because people have to dig up lines, give it to you, they charge you money, whatever. Villages never even got it. The cell phone changed that completely. Now everybody, a farmer in some village somewhere who is not even literate, still has a cell phone and can talk. And so that's completely changed communication. And the cell phone technology, which is not just the phone itself, it's the connection, it's the the wireless connections and all of that, the satellite connections, all of that infrastructure to be created, and the cell phone itself was to be created. I think that same model applied to healthcare as monitoring and connection with patients at a local level increases, and that data is sent to the cloud and information is sent back. Can it one day, I think sooner rather than later, provide healthcare into developing countries' villages, and in the end provide better care, because if you can do that early and you don't have a system which is already sort of created in the Western world where you get paid extra for treating iller patients, and so there's almost a pushback against treating people too early, not intentional, but that's what the financial system gets you to do. Can you then, in the developing world instead, through this methodology, find out who's ill early, treat them early, and in fact, improve healthcare in low-cost and underdeveloped countries without thinking that I need to spend a ton of money and build hospitals to improve my healthcare? Can this move with AI in healthcare and technology in healthcare make such a dramatic change? I don't know, but it's something that I hope happens and something that I'm personally very interested in, and in whatever way I can, I try to kind of work in that area. I'll stop right there, and let's open this up for questions. Thank you very much for your attention. But let's start with that.
Let's see if I've got this on. Great. Thank you so much, Omar. It's such a pleasure to have you here with us today. I lived in Bangladesh for 5 years, and every time Omar would visit, it was always kind of a combination of a head of state and a favorite son. So we're very lucky to have you, and you're quite modest. You have a PhD in engineering, so I think on many of these topics, this should be a great discussion. I should also say for the rest of us, it also goes to show you the bad news: no matter how high up you go, you still have to make slides. So thank you very much for those as well, Omar. You spoke quite a bit about access, and maybe we can kind of start there, because some of the discussions that we had earlier, including with the colleague from Google, was around equity, right? And you ended on this note, I'd say an optimistic note, about the potential for AI to be reaching people around the world. I think at the same time we see that many of the platforms for AI are being predominantly built on the west coast of the US, right? So what do you think needs to happen to basically bridge this innovation that is happening primarily in wealthy coastal areas in the US and in Europe and other high-income countries with the needs of people in low-resource settings?
Well, look, the access is available. I mean, all they're doing on the West Coast, they're building the data centers. I don't need to build a data center in a village to provide AI access to the village. I just need access to the data center. And that you can get. Now, there's a charge for it, and you have to pay for that. But if you use it more, the charge goes down. And governments should build their own data center. It's not that expensive. I mean, you don't have to have the latest and greatest to get going here. We're so far behind. None of this is used. Let's start moving the needle. So I don't think that's a fundamental barrier to start to move the needle. And also, in a slightly different note there, work's going on in making those, we heard earlier about how expensive these are and how big they are and all the work that's going on. But I can tell you in the tech industry, in the semiconductor industry, we're working on ways in which we can make needing less power, more efficient, smaller, because there's work going on and that'll happen. I think the need for data will not stop. So, it's similar to the PC, like, 30 years ago, 40 years ago, what we worked then seemed like a lot. Today it's like nothing. And we still learned how to use it. So it got cheaper and faster, but we knew how to use it more. The same way, I think the data center is the same kind of revolution will happen. I mean, this is the fundamentals of semiconductor industry. I mean, Moore's law isn't quite as steep as it used to be, but it's still there. And so I do think data centers will get bigger and cheaper over time, and their usage will continue, and so they're not going to mature in that way. But from a healthcare perspective, there's enough there already. Get started. That's what I would say.
So you think there's enough out there to already start building applications?
Absolutely, absolutely, no question about it. Way more than you can start moving the needle right now.
So you mentioned semiconductors and data centers, and I think that raises an interesting question as well around the role of the state in all of this. So you're on the board of Intel. Intel is one of the major recipients of the CHIPS Act in the U.S. We talked earlier this morning about the U.S., China global competition. So what is the role that you see for governments and state actors in driving AI and AI specifically for health?
Well, no, that's a good point. I do think most governments around the world, want their own data centers. They're probably more for the right reasons, worried about security and everything else, because that was a nice chart I showed there. But, the moment you do that, you have every person's information in the cloud. And how do you need to, what kind of data protection do you need there to provide people's privacy, and all of that needs to be put in place. I think, look, every country around the world, is thinking, governments are thinking of building their own data centers, not only for healthcare but for other things. My only advice there would be, governments tend to be more infrastructure heavy as opposed to application heavy. So they want to build the infrastructure, and then what? And often I've learned this, and I've learned this even in developed countries. People keep talking about the infrastructure, and when the infrastructure is there, 3 things are missing for which you can't use it. And I've seen this, when cloud services were first provided to the US in major hospitals. It took 5-6 years before it became completely implemented in all hospitals, because doctors didn't want to use it because it was worse than doing it manually. Because it didn't have like 3 or 4 little things. Like the documentation wasn't right, or this wasn't right, or they couldn't transfer it correctly. And unless you actually use things, you don't know what all the needs are. And so I'd really encourage governments, create your data centers, but translate them to applications in healthcare and other areas sooner rather than later. I think they should get the benefit and rewards for getting value created from it, rather than spending the money and simply creating the infrastructure. I think a tighter connection to translating the infrastructure to value, certainly in healthcare, but also in other areas, I think is very important. And I think that's the way government should look at it.
So you mentioned doctors just now. And one of the topics that came up also earlier today was just the impact of AI on jobs. Do you have thoughts about how you see AI changing the practice of medicine from doctors and nurses and other health professionals?
I think it'll just get better. I think doctors will spend less time doing things that are mechanical. They'll learn things. The fact that the tumor can be diagnosed more accurately automatically is fine, because then you can work on, well, what do I do about it? Okay, this person got tumor. Let's work on, I've got a very early stage. How do I treat them? Are there new methods of treating them? So I think more information to doctors can only help. This is not a place where, look, we can talk all we want about data centers and AI and all of this. We're not even close to the human brain, I can assure you. Not even close. The human brain, as was talked about earlier, evolves by itself in a way that computers don't know. Computers are still, robots and all that, but everything is taught. Data is there and models are created. Now, they're very good. Computers with data gets very good at isolating information that humans cannot physically isolate. But humans will learn how to use that in different ways. And so I think doctors will just get better, because if the information that they're provided is not manually done, they'll have much more information about a patient. And, there's some things that need to be crossed, because there are boundaries that have been drawn in the healthcare systems where, especially in the Western world, where, If you go to a cardiologist, he'll only look at the heart. And the body is more connected than that. The heart might be doing something else while the cardiologist doesn't know anything about it. He won't get a right referral. Sometimes you can get into serious problems because of that. And so this very narrow focus on healthcare, which is important because, there's a lot to learn about the heart. And there's the nervous system of the heart, there's the vascular system of the heart. Two different doctors. One is the electrophysiologist who looks at the nervous system. It's the vascular cardiologist who looks at the vascular system. If I told a vascular cardiologist to look at the nervous system, they have no idea what to do. So it's that narrow. And so it gets so narrow that the treatment gets very narrow and side effects don't get understood. And so I think doctors, connecting with each other with all this easy data availability, I think healthcare has to evolve and change. And the more pushing the envelope in terms of new knowledge that the doctors spend their time on, as opposed to filling out paperwork, I think healthcare will get better. So that's the way doctors should think about this. So
we're not talking about replacing doctors with AI anytime soon.
I think some of their actions you are, but they're thinking of other actions. So like I said, if they learn the human body, there's new things they can do. So that's the way I see it. But certain actions, yes, we will replace, and we should.
Great, so I just have two more questions, actually, not about AI and health, and then we'll open it up to the group. Your favorite son of Bangladesh, you were just there, I think, earlier this week. The country has gone through a large transition this year. What are your impressions from being on the ground in Dhaka in terms of what the challenges are, what the outlook is for Bangladesh today?
Well, look, I'm not a political expert, so I'll say that up front. And I'll just give you my personal experience in the 2 days that I was there, or 3 days. I thought it looked fine. I mean, I didn't see anything that different. The only thing I'll notice is that some of the infrastructure work that was created in the city had slowed down a little bit, and they're coming back to do that. I think the country is just going through a process of change. Hopefully, I think they're doing the right things in recreating the infrastructure to create an environment where the politics can be done in as fair a fashion as possible and biases are removed. And I think Professor Yunus is focused on that and kind of working on that. He's engaging as many people as possible who have know-how, not just in government, but just in general, foreign experts, and we'll see where we go from there. But I don't have too much more to say other than that. In that, I'm not really engaged with the government in any way. Although I'm seeing the health minister when I go back there in the next few days, and also a brief meeting with Professor Yunus. Let's see how that goes, and I'll try to help in any way I can. But I'm not getting into the government, I can assure you.
On that note, why don't we open it up to questions from the group? So we'll just go one by one. We'll start over there.
Hi, thank you so much. My name is Amy, I'm from Brunei, and I'm very curious to hear if you can, or you've seen examples of countries that are now only emerging in the digital health space, where they can leapfrog existing economies, because I think there's opportunity for innovation that exists there. But I would like to hear maybe more from you in terms of what you've seen that's really interesting.
Well, I think it's still in the early stages, and I don't want to make AI sound, AI has got more visibility now, but the data availability and some of the capacity to do all of these things has been around for a while, and people have been doing it. And I find, without naming any specific countries, we have to think through that. I'd say that actually smaller countries are doing better than bigger countries because they've got more focused efforts. The example that I gave of the pacemaker example, that's because you try to solve a problem like that for the whole country, you've got too many variables. So instead, if you pick on small communities and do top to bottom in a small community and then do another community top to bottom, you'll get better improvements in outcomes than if you try to create horizontal infrastructure. So countries which have done that And the smaller countries have done that. I mean, Singapore, it's small, but it's a good example of where the healthcare system is pretty well connected. And they could still do better, but it's not bad already. So I would say that the smaller countries, I mean, there's some programs I'm working on. They haven't moved the needle yet, but they're thinking along it in the right lines. Places like Kenya, some places in Africa are doing that. I think there's some countries in Europe where they have it better than others. There are provinces in Italy where they do it very well, but not all the provinces. Again, this is constantly changing, but I'd really say that countries where they're looking at focused populations and trying to move the needle in specific areas and do it in an organized way are the countries where they're doing it better rather than creating, horizontal infrastructure and hoping somebody does something about it. Okay?
Great. We'll just work our way across the room in the front.
Thank you. Nyata from Myanmar. You mentioned that AI is not quite there in terms of beating the human brain. But how about AI versus organizations, right? We think about the classic treatise, the nature of firms and why firms and organizations exist. You've run a massive global conglomerate. How will AI affect management, organizations, decision-making, allocation of resources in both the private and public sector?
I think it'll change it dramatically. But look, this is just an acceleration of a process that started a long, long time ago. Because 40 years ago, there were no spreadsheets in computers. Now, no business can do anything without a spreadsheet. Okay, so things will change. People will learn how to use it. People will think AI is just something you use. It's a tool. And so I think organizations will have to adopt it and jobs will change. They just will. I mean, take the cars. 100 years ago, people used to go in horse carriages. Those guys are out of jobs. Well, that's how it is. There's cars instead. Things like that will happen. And AI will drive a change in expertise, a desire to change in expertise. Some people will do it slower than others. But in the end, this is not something that's just going to stop. And you certainly cannot regulate. If you regulate it, I can assure you people will find ways around the regulation. They're smarter than the government people who are just putting laws in. You just find 15 ways in which I'm going to work around that law. So instead, think through, engage the tech community, and I am worried about some of the security things and all of that. But there could be some kind of rules you could put in place where security barriers are put in as to how you use the data. I mean, we know from these examples where you kind of create these false videos of people and so on. Which, of course, if you use it for the wrong purpose, it's wrong. But some people use it for entertainment, for real entertainment. And there's nothing wrong with that. So how do you draw the line? So I think that requires a little more thought as to how you draw some of these lines. And it's never going to be perfect, but you should make an attempt there. But the answer is not, stop technology. That's not going to work. And it'll evolve over time. Okay? Yeah.
Great. Thank you.
Thanks, Dr. Ishrak. Ishrak, I'm Nikhil Pawar from Media Normal India. I was wondering about, one of the things that we're seeing is that LLMs are now moving very slowly so far to edge devices.
Yeah.
And one solution to the privacy and the data problem that you suggested is on-device, on-device hosting of data. I'm just curious about, in all that you're seeing, are we seeing any open sourcing of health-related LLMs? Are we seeing any movement to edge devices? Because that's one way to solve the privacy conundrum with health data.
Yeah, no, I think there is. There is. I haven't seen that quite at the early stage care, but in hospitals I've seen a lot of that, where there's information regarding tumor detection and all of that. Those models are better if you take data from many more patients. And many hospitals will get many more patients, but you don't want to kind of take data from somewhere else or give up the patient's name. And so that security platform is being developed. I mean, I forget all the names, but there are certain algorithms that are being put in place where patient privacy is actually maintained, and yet the clinical information is pulled out. So I think that work is happening more in the hospital-based infrastructure right now, primarily because the people there can afford to employ the data scientists more than little clinics and so on.
So the other part of the question was, are we seeing any open sourcing?
There is open sourcing in that area. There certainly is open sourcing in that area for algorithms. I think the generative AI part hasn't quite got there yet, but it will probably soon. The diagnostic part, there is certainly open sourcing. But generative, I haven't seen any yet, but it's a matter of time. Yeah.
Thank you, Dr. Omar. My name is Josh from Singapore, class of 2024. So you may know Professor David Hoffman. He is part of our board, which is the Future of Privacy Forum. So I work in the tech law and policy space. Two quick questions. Now, consumer tech companies are becoming health companies, and health companies are becoming tech companies. What do you make of that dynamic?
I don't think that those are words. For a consumer, what do you mean by health company? What do you mean by tech company? I mean, it's just a general definition. But I can tell you one thing. Companies like, you name it, all the tech companies, they're massive companies, all right? Google, Amazon, Nvidia, you name it. They're not in healthcare. They're not driving healthcare. Why are they not in healthcare? The reason they're not in healthcare is that when they try to go into healthcare, they go back to my first chart, which is to get a value in healthcare, you've got to get an outcome. To get an outcome, you need physician training. You need to understand the human body. You can't just sell it to individuals. That physician training, and I've learned this over the years, and that market creation that creates specific healthcare treatments is actually more difficult than the technology itself. Because the technology itself, I'm not trivializing it, it's still difficult, but once you solve it, you solve it. When you're trying to change and train a physician, you've got to do that differently in every country in the world because their backgrounds are different. The healthcare policies are different. The referral chains are different. And so, and until all that is done, you can't scale it from a business perspective. And so if I'm sitting here at a tech company and I'm doing my business review of projects that I'll do and I'm looking at my return on investment, this is always going to take more time and it's going to cost more money than I sell some kind of device which a gaming audience will take. Because I don't need to prove anything there. It looks good, they'll take it, they'll sell it, I'll get my money, my return will be quicker and faster, with less risk than going into healthcare. And so if I sit there and have all those options, I'm not going to choose healthcare. Now, I may be generalizing, there may be people who are really focused on it, who've got a mission to do it, that might happen. But right now, I know, because running a company like Medtronic, I know what it takes to create a product that has to have safety, that has to have a clinical impact, that needs all the approvals, that needs the training. This is not easy. This is not easy. This market creation is almost, like I said earlier, more difficult than the technology itself. And for tech companies to go there, I don't see it. I mean, they can call it healthcare, but all they'll do is just label something. I mean, Apple did a little bit, but they didn't close the loop. They provide ECG signals and all that, but nothing beyond that. What do I do with ECG signals? I don't go there because that gets too expensive.
Yeah,
so
thank you.
At least that's a view.
And that's very insightful. And my second question is, what do you think are the challenges of agentic AI in healthcare? Is it human oversight? Is it data privacy?
Agentic AI?
Yeah.
Well, I think the challenges there are more at this stage. There's I'd say two things. First, to do that properly, you'd need, well, some of it is just changing an existing system. There's a bureaucratic aspect. I mean, I'll take two aspects. One is changing the healthcare system. In other words, when I go into the hospital, my records are known, I get directed to the same place and all done automatically based on that. That portion of it can be done today. That's more getting physicians comfortable with it. Because they'll say, you're doing this, I'm not sure what's going on, I don't have time to learn this. So you've got to make it easy, and there's some companies doing this already. Make it easy so that it's just a plug and play for physicians. Make it easy. To do that isn't trivial, but it can be done. So that's one aspect, to make it easily usable by physicians. The next level of agentic AI, which is one I'm very interested in myself, which is how do I actually manage patients' diseases? For that, I need better monitoring methodologies, and that's being developed too. Automatic, sort of regular blood pressure monitoring, which it doesn't require, pumping and all that stuff. Non-invasive glucose measurements. There's all kinds of other technologies that are evolving, and when I take those technologies and apply them, then I can automatically and optimally treat a patient. I'm almost putting an electronic organ in their body through monitors. They're the technologies required. But the first one, those monitors and things, and those devices are being worked on, but they're not quite at scale yet. But the first part is all there. This is a matter of getting doctors comfortable with it, making it easy for them, and there's companies doing that. Okay?
Great. In front.
Well, this is quite fascinating, and I'm just wondering that as age spans increase, and I often hear about the fact that we only sort of have understood 10% of the brain. Two related questions. One, of course, that as age spans increase, there are other kinds of, disorders that we're seeing an increasing prevalence of, whether it's dementia or Alzheimer's, and huge sort of upsurge of that, even in South Asia. On the other hand, so my first question is, can AI is it working towards solving for some of those problems? And this other piece of 90% of the brain, we haven't really got there, is that likely to get accelerated with the use of AI? I'm just curious to hear your insights based on, the fact that you're right there in the nerve center of where all these developments are taking place.
Well, it's not that black and white. That it's not 90% meaning, this part is not doing anything. It's the way in which the different neurons and so on is used, and different portions are used, and they're evolving themselves over time. I'm not sure we understand it all. We don't really understand the nervous system that well. There's many things we don't understand. I don't want to go into too much depth, but there's a vagal nerve here, which is a whole collection of nerves, and that addresses the entire body. And from that vagal nerve, you get nerves that go into the kidney, that go into almost the heart, the liver, you name it, and all the nerves are collapsed into that vagal nerve, and they're not like isolated from each other. And there's signaling that's happening from the brain, coded signaling that's happening, that's directing the signal to go to the right place, and that can change depending on how I'm feeling. So there's a lot here that we don't really understand. And we just, the vascular system is a little better understood, how the blood flows, but the nervous system, I think we're in the very early stages. And the nervous system is tied to the neural functions a lot more directly. And there's many things here that, and I think AI will help a lot because, what AI does is it looks at long-term data and it gets signals from it. And by looking at this data from the brain, without putting probes in, you can probably pull things out. And I think that'll happen. Some of these early treatments of, certainly essential tremors there, but there's different diseases which that data is being pulled out and treatments being put in. So I think that's the way I would look at it, that the brain, how it uses the data, rather than parts of the brain which are not using it, doesn't work that way, just not using its full capacity is the way I would say it. And we're in very early stages there. The neural system management is very early stages. Okay.
Let's take the gentleman in the back.
Hi, my name. Oh, that was loud. Yeah. Hi, my name is Shah, class of 2024, and I'm from Bangladesh as well. So I run an organization called Footsteps over there, where we are working on digitalizing rural pharmacies to help pharmacists not only manage their medicine inventory, but also use it as a satellite health center to connect rural patients with doctors not only in Dhaka and Chittagong, but also like a Bangladeshi doctor based in New York itself. But as Bangladeshis, we also know that technology, specifically when it comes to AI, is still overwhelming for a lot of people, especially in the last mile. And there's also a trust issue with technology when it comes to rural areas, not only in Bangladesh, but in other developing countries in the world. So my question to you is that, how do we get communities, for example in Bangladesh, rural Bangladesh, ready for like an AI revolution, specifically in the health sector, especially in a country where misdiagnosis is also a very big issue? Thank you.
Well, you know, I almost have the reverse view of technology and AI. I think what you're hearing about this is that it's actually going to get less sophisticated from a usability perspective at the ground level. So, you know, these AI models and all will make it simpler, not more difficult. People won't even know. I think the bigger burden that has to be solved, first of all, have enough people who kind of learn how to deploy that and think of the right models through which you deploy that. And I encourage always, because of the example that I said earlier, no matter what you do in healthcare, walk your way to an outcome. Because the outcome is where value is created. Like in your case, if you're providing these medicines, how are people using it? Who's getting better? Do the measurements. Take a group of people in the villages where you have that. Is their blood pressure rate going down because they've got access to medication? If it's not, what else is wrong? So I'd encourage this thinking of a line of sight to an outcome as you decide how to focus. And I think as long as if you improve an outcome, the other thing you'll get is you'll get acceptance. If you know, you can have whatever pushback you want, but if I tell somebody, you know, your parent is going to live this much longer, is going to die, and this would fix it, and I show that, I think we'll get a lot more acceptance than if you just try to sell, like, you know, adopt technology because it's modern. And so that's the way I would look at it. I tie it to an outcome, and I do it that way, and I try to kind of do the measurements to see how you're making improvements, and through that, how you're making healthcare cheaper and more accessible. Not by cutting cost of deployment, but by cutting unnecessary costs because of clever usage of technology. Okay, we can talk offline a little more because I've got some interest there as well in Bangladesh.
Can I ask a second question?
So we just
Very
have,
short.
okay,
Very
very short.
So, you know, Bangladesh is also the land of epidemics in a lot of ways. Dengue is pretty big over there. And last time when there was a dengue epidemic, the mayor of Dhaka created an app which had no use. So how can, like, you know, people like yourselves influence governmental bodies back home to make right decisions, and what kind of technology can be effective on the ground as well? Yeah, that's it.
Yeah, I think that one need to be specific to answer that question. And you know, to the degree that the government reaches out and asks for help, you know, we'll do that. But you know, I can't go in there and run the healthcare system. Right? That's not, I just can't do that. But you know, if they're asking me to help, I'll do it. And I think most other Bangladeshis who have that expert, whether they're local or they're abroad or for any country, especially in healthcare, people will want to do that. Okay.
So we have time for 2 last questions, and we'll take both of them from the table over there. Go ahead.
Thank you for the presentation. I'm Kana from Japan, class of 2024. And being a vaccine researcher on vaccine communication, I completely agree that the prevention is a critical part for both maintaining the quality of life for individuals as well as the cost management across the industry. But I think the difficulty is in how to communicate the importance of prevention. You know, when you're successful in preventing something, you never get to know what the cost was or what would have happened without the prevention measures. So if you have any suggestions or thoughts on how to communicate the importance of prevention, it'd be truly appreciated. Thank you.
Well, I think that if someone's focused on it, they can get that information. By preventing, you'll get less disease. You can measure the amount of people with certain disease. And by putting preventive measures in action, I mean, there's a project that I worked on which looks at rural communities and managing to make sure that they're getting blood pressure treatment. And it's very simple. I said that that's why earlier on I said take small focus groups. You know, I just insisted that you know, you're doing a blood pressure treatment. I need in 6 months to look at data to show that in that village, are there more people with blood pressure or are there less? You know, there should be less because of everything else I'm doing. By how much less? And you know, I think that's why I keep repeating over and over again that a walk to the improvement in outcome from whatever you do in healthcare is so important. And when you do that, then you'll get your prevention data. Because an improvement in outcome shows that you're not sick. And you're not sick because you prevented an illness. Or you cured an illness and it won't happen again or something. So I think connecting to data, if you put something in place, you cannot just put the infrastructure in place. You've got to put in the clinical roadmap. And when you put the clinical roadmap, there's a walkway to an outcome. Once you have a walkway to an outcome, you know what the desired benefit has to be, you measure it, and that's the way you do it. So that's what I would encourage. And unfortunately, governments and healthcare ministries tend to be much more thoughtful about creating the infrastructure before thinking about how to use the infrastructure, and that's the change that I would encourage.
So I've been given the signal from Sanjeev that we're out of time, but I know we said that you could ask your question, so very briefly.
Yeah, and I'll give a brief answer. Okay.
Hi, I'm Ufra from Kashmir. My question is really around two things. Since the topic is about democratizing healthcare, how do we do that in places with ongoing conflicts, for instance? And I'm also looking at gender dynamics, for instance. In today's time, there's still a lot more research that needs to be done, for instance, pain management for women especially. There's so much gaslighting of chronic illnesses, autoimmune diseases when it comes to women out there. And I absolutely acknowledge there's so much we don't know, and there's so much that's coming out of neuroscience and all of that. So any key recommendations, especially on those two aspects?
Well, first, I know I said we don't know a lot, but we also know a lot. And what we know isn't applied everywhere. That's what you're saying in many ways. That, the thing that I try to prevent is my pacemaker example. And that's just one example. But in many areas, like the women's diseases and so on, you're saying, if there's a solution for something and in a certain country you don't have a certain kind of disease, then you should be focused on that country where the disease is prevalent and how to address it. I'll give you a slightly different example, but as an example, in cardiology, pediatric cardiology, little children, often babies are born with abnormal cardiac anatomy. In the West, that's always detected before birth and treated immediately, because actually if you treat them straight away when the baby's a baby, the baby's fine. And it's easier to treat sometimes because you've detected it straight away. So pediatric cardiac disease resulting from abnormal cardiac anatomy is almost absent in the Western world. Yet, in the developing world, it's massive. It's massive. The death rate of children is high because first it's not detected, and second, because those patients don't come in, hospitals don't have the expertise for pediatric cardiology, which is different from regular cardiology. And so just things like that, that's why I keep saying here, focus, end-to-end look, connection to outcome. So almost every question that's been asked, I've always come back to that because that's what's missing in healthcare. Healthcare, the heart is different from the brain. The vascular is different from the nervous system. The adult heart is different from the pediatric heart. You got to recognize these. And so it needs focus, and it needs a tie that whatever I'm doing, when do I see the improvement? And what else do I need to do to get that improvement? So that's what I'd encourage. So I've given the same answer, but just apply it in that way. Okay?
Omar, thank you so much. I think the next outcome we have is drinks and dinner. So
thank you.
Thank you, and on behalf of Asia 21, thank you.
Thank you all very much.